Thank you so much for joining me on the director's chair. Today, we're talking about my film, It's Not Personal, It's Just Healthcare. And joining me in the other director's chair is our distribution partner, Akua Smith, out of New England. Akua, thank you so much for being with us.
Yeah, you're welcome. Thank you. Thank you for doing this, first of all, and thank you for letting me be able to speak a little bit to how impactful this has been in my business and my life.
That's exactly why I made this film. A lot of people don't understand that as a filmmaker, I can only affect the industry so much, right? And so the whole point of creating this film and putting it in the hands of a forward-thinking benefit advisor and consultant like yourself, who can actually guide employers and change health plans, that's the ball game. That's exactly what we're here to do, because without forward-thinking benefit advisors like yourself, no change happens. I tell people all the time that if documentaries alone would change the world, we'd already live in a paradise, because right now on Netflix, there's got to be 1,000 documentaries. Right? So thank you so much for being one of the forward-thinking advisors out there who's taking this film and actually making change in the marketplace.
Well, and I just have to say, Bart, thank you for giving us the language, the words, the visuals to be able to share, right? Because you can be in this space and be a feeler and a knower and see the things and say, okay, I know this is not right, but I don't know how to unravel it and speak to it in a way that makes it simple enough for employers and employees to get it, and to actually have the interest and desire and the passion after getting it to start making the changes.
Well, absolutely. And I'll tell you what, before we go any further, let's watch a little teaser from the documentary so that way everyone knows exactly what we're talking about.
Even 30 years ago, it was easy to recognize that there were problems.
The amount of self-dealing, the conflicts of interest.
I was met with responses like, this is the way we've always done it. I just couldn't accept that.
I was a propagandist, and I was a part of the effort to mislead people.
It is the largest game of three-card Monte that you'll ever see in your lifetime.
There's a solution. We've been solving this problem for 20 years.
We realized we can charge a tenth of what a so-called not-for-profit hospital charges and still be profitable.
Often it's just unquestioned. And these companies are leaving a lot of money on the table and getting ripped off in many ways they just don't acknowledge.
So, Akua, how did this film sort of mirror your experience in the healthcare industry? How did you get started? And at what point did you realize, hey, wait a minute, this isn't a fair game?
Yeah, I'm going to go back a little further probably than you would imagine that I would go back, and just to the fact that I started my working career as a missionary in East Africa, in Uganda, East Africa, with a public health focus, right? Hygiene, safe water, access. So I'm working with folks who had limited access, and I was partnering with them to, enhance the opportunities that they had to get care, right? And so when I came back to the U.S. after living in Uganda for 7 years and wanted to work for profit so that I can continue to give overseas, but yet make a difference, I went to work for a national carrier, right? It was my first job because they were global, because I thought I could do good in this space as well. And I started out working with patients, right? So case management, and then moved up within the organization over a 13-year period. And the more I learned, the more I saw, especially once I got onto the sales side and working with underwriters, et cetera, I began to see things that really challenged who I was, right? Remember, missionary, living overseas, wanting to help people, and starting to have these challenges around, okay, yes, this is a for-profit organization or company. However, my clients that I'm representing, right, as a salesperson, you're supposed to sit on both sides of the table and support the clients as well as the business's goals. I felt like I was getting to a point where it was difficult for me to do both of those things because of all of the things that I saw, the thousands of streams of revenue, the margin that I felt like sometimes was exploitative.
Yeah.
Okay. It really challenged me as a person and my ethos. And so moving on to the producer side, the advisor side, was really about how can I help these businesses and their employees really have access to comprehensive, affordable, controllable, predictable healthcare.
Well, and was it ever for you a matter of, I just have to make the playing field level again? Because I think for many, many years, employers out there have heard the same story over and over again. They feel painted into a corner, right? And they don't realize that there are other options out there. Did you find that when you went out into the market as an advisor, speaking with company leaders that just simply didn't know that they had choice?
Absolutely. First of all, when I came over, I didn't know necessarily that they have choice, right? I was in larger markets where there was a little bit more choice. I'm in a smaller market now in New England, where I was told out the gate, first of all, with my employer, the carrier, that there's only 2 or 3 options anyway. They're going to come back to us, right? And so I came out as an advisor saying, okay, there's got to be more. And baptized in the fact that there's got to be more, and started looking for the options so that, you're right, I could level the playing field. I could help employers understand that you don't have to do it this way anymore. This is not working. This is broken. They're all saying this to me. I'm getting it. I'm understanding it more and more. And so, okay, how do we fix it? How do we find the other options? Where are they?
Well, and I think employers forget that at the end of the day, the entire healthcare system is a for-profit system. So I've got another clip queued up from the documentary. Let's take a look.
What an employer or an employee calls premium, a health insurance company calls that revenue. Who wakes up in the morning wanting to lower their revenues? Nobody. So the reality of that is fundamentally the whole system is built incorrectly. Everybody in that food chain makes more money when costs go up. The health insurance company does, the broker does. If you make commissions, I make commissions off of premium. Premiums go up, I make more money. Hospitals need to fill beds. Doctors get paid more the more services they do, the more prescriptions they do. PBMs make more money. So the whole system's rigged against the true outcome that is trying to be desired, which is we would like to actually lower cost.
Insurance companies and the brokers have been telling employers for decades, you can't control the cost of healthcare. We wish we could. We do the best we can, but don't even think about it because it's not possible. Healthcare costs are going to go up every year. By the way, so are your premiums, so you can get used to that too, but you can't control the cost of healthcare.
So I love that line. Premium equals revenue, and who wakes up in the morning wanting to lower their revenue? How true was that line for you when you were working for a major carrier? Did you see this, and do you still see this in the marketplace today?
Absolutely. I love this clip. I love Lester because it's like he is speaking my language 100%. So at this carrier that I worked at, I was also a shareholder. So I'm sitting on these shareholder calls, right? And I'm hearing how amazingly we're doing every year, how much profit and revenue that we are making as a company. And then I'm coming out of those meetings and sitting in meetings with clients who are having to cut their benefits and or pass these costs, double-digit increases every year onto their employees, and then their employees are functionally uninsured. That's essentially what it looks like for them. And so this clip absolutely makes 100% sense to me, and definitely is I agree with it based on the experiences that I had when I was sitting in that chair. And I think about a municipality that I was working with. That is a big reason why I left the carrier side and came over to the broker side, because year after year, this municipality who is struggling, right, is getting double-digit increases. And their producer, their broker, was essentially taking what we sold them to the client and reselling it to them without ever doing any work or very little work in trying to uncover what are the true costs? How do I get these costs down? And the nail in the coffin for me is when he brought a third-party vendor to the table and said, I'm adding this vendor on. And I said, well, this vendor is not really going to help the situation. It's going to add more costs. And his response to me was, they're going to actually add in some additional commission from me. And I can't ask the city for additional commission, but I can add this commission in this way where they don't see about it or see anything about that and how it impacts their costs.
Well, I mean, and that's just a prime example of the misaligned incentives that we see in the health insurance and the healthcare marketplace.
Right.
Right. Where everyone makes more money when costs go up.
That's it.
As I tell company leaders that I talk with after a viewing of the film, there's only like one or two inputs of money into the system, and that's you, Mr. or Mrs. Company owner, or your employee.
Right.
Right. And so that's the only place they're getting money from.
Right.
And then I think there's this big misconception that carriers are supposed to control healthcare costs and they're supposed to fight with the hospitals and the doctors to keep costs low, but that's not actually how it works. Right. So let's take a look at another clip that will explain the very reason why these two sides of the coin aren't fighting amongst themselves.
One of the little known clauses in the Affordable Care Act was the medical loss ratio requirement for insurance companies. The medical loss ratio, or MLR requirement, limited the insurance company's gross profit margin to between 15 and 20%, depending on whether it was a small company or a large company that was being insured.
So if you're an insurance company and you can only keep, let's say, 20% of the premiums you take in for profit, right, and overhead, how are you going to grow your bottom line? The only way to grow that number is to grow the total cost of healthcare, because 20% of $100 is more than 20% of $10. It's just math.
So 20% of $100 is more than 20% of $10. So like carriers are under no incentive to fight with hospitals who want to raise their price for surgeries, or fight with PBMs who want to raise the price of drugs, because the more they charge, the more carriers get to charge in premiums.
Exactly. Yeah. And one of the things that I was taught early on when I was on the carrier side is the claims are the claims, right? This is what we preached in every meeting. Oh, your increase has to be this because your claims are just increasing. And the claims are the claims. You can't do anything about the claims. All we can do anything about is the admin fees. And look at our admin fee. They're so low in comparison to every place else in the market. And so now as an advisor, I'm working very hard to unravel that lie, because it's a lie. It's 100% a lie. There are so many things that are being put into the claims, first of all, that are not really claims, that are the carrier or their vendor partners kind of hiding little fees in there, right? Mm-hmm. And then the dummy code. So there's so much that's going on that if you believe that lie, then you're not going to try to get under the covers to understand why your costs are increasing so much.
Do you think that there is this idea among, the broker community or the hospital community that, oh, well, if we up our price, the insurance is going to pay for it, so no harm, no foul, right? As if the insurance companies do not respond with higher premiums. I feel like sometimes these charges get added on and prices get inflated because, well, the insurance company is going to pay for it, right, and they've got plenty of money, and they don't realize that those chickens come home to roost.
Absolutely, 100%. And, the insurance company is, in most cases, especially when we're talking about self-insured groups, are not paying it. It's the employees and the employers that are paying these rising costs. And, and even sometimes the insurance companies will, in their conversations, well, don't forget about the stop loss policy, right? Well, yeah, but you have to get get $50,000 or $100,000 or $200,000 in claims that the employer and the employee are paying for before we even hit that point. So you're absolutely right.
What is the response from company leaders and HR and employers when you sort of pull back the curtain and tell them that, hey, you know what, everybody's kind of in cahoots, to extract as much revenue from you and your employees as possible? What's been the reaction when you have this conversation?
It's kind of a two-sided coin, right? On one side, it's like, it's unbelievable. No, like, these are my friends, right? That was my job, to go out and to be your friend. Let's go to lunch. Let's go to dinner. Let's hang out. Let's go get our nails done, right? These are my friends. They wouldn't do this to me. That's one side of the coin. Yep. But then the other side is just absolute amazement and frustration. And, it does take sometimes a few conversations to help them understand, like, this is real. This is really what's happening behind the scenes and under the covers. And yeah, there's this great person that you're working with on a day-to-day that you really like. But let's get down to the brass tacks. Let's look at the contracts, right? Let's understand what their position is around fiduciary. Let's ask them some hard questions and see how they come back. And it's interesting because one of those clients that I mentioned, a municipality that I currently work with, we've spent this last year, because I've now been an advisor for 2 years, and looking under the covers and me showing them, hey, you see this? You see this behavioral health program or these out-of-network fees that you should not be paying? They exist, and they exist at very significant dollar amounts, like the $500,000 range. And that's what your friend is bringing you. And maybe they understand it and maybe they don't. But guess what? The company understands it, and they're doing that intentionally. This is a part of the plan.
Well, and I've got another clip lined up that I want to get to. But before I do, I feel like, these company leaders have heard the same old song and dance for so long that you've got part of them that are starting to question it. And then you got a other half that has just accepted it because they've heard it so many times. Let's take a look at a clip where we start to talk about the same old song and dance at the renewal meeting.
For 14 years of my 22-year career, I did health insurance the normal way. These are your 4 or 5 carriers you could work with. They've got their products and their menus of services. You pick from that menu, and then you try to get creative. So it felt like I was an actor. I would play the same game every year. A renewal would come out, we would shop it to the other 3 or 4, cast of characters, none of which that have a vested interest to actually lower money, right? Premium equals revenue. We would do the dance. We'd increase deductibles and out-of-pockets. We'd take more out of the paycheck of the employees. And then us, as the advisor and HR, would go stand in front of employees, getting them super excited to pay more money for a crappier plan. Rinse and repeat, rinse and repeat, rinse and repeat. I would ask anybody that's listening, what is the number one strategy their advisor has used to lower their cost? When that answer is, not if, when that answer is passing on more cost to the employees and their families, is that what we intended?
It's a great question. Is that what we intended? Because I'm sure every advisor goes through that when they're working with major carriers before they discover advanced strategies. They've got their list of characters, right, that they work with. I'm sure you experienced that. What was that like for you? And what was the transition like out of that?
It goes back to kind of what I was saying earlier. And I think I would, just add in to this clip is that many of these folks are not nefarious, right? When Lester was doing this, when I was doing this, a lot of the people that I work with were not maliciously trying to, sell these businesses things that we know are, going to completely rip them off. It's just that we are trained in this way, right? And have enough understanding that we think we're trying to help them do what's best for them, and we're doing what's best as well. But to your point, right, it's like coming out of that cloud, that dark cloud, and saying, okay, I want to know more. And that's one of the things that I did when I was sitting on that side is, okay, underwriter, explain to me what trend is. I want to understand these things in detail. And as you really start to become inquisitive and ask the questions, then that's when it unravels, right? And that's for employers when you're talking to them. And you see those ones that are asking you those same kind of questions. Well, can you explain to me why this is this way? Can we go a little bit deeper? And I think that's the requirement for folks who want to get out of sort of this mousetrap or, this sort of round and round thing that we get stuck in, is start asking the questions. And that's when the door gets shut in your face. And that's how I realized it's like, okay, the people who were super nice to me and wanted to give me the education, but when I went too deep and I started to uncover the real truth, that's when the door gets shut in your face and, okay, you've learned enough, no more.
Well, I'm glad you brought that up, that, these folks aren't nefarious, because that was a big point in this film. Is I remember showing the film to several folks, and some of the comments we got back was, well, there's no clear villain. And I said, you know what, well, that's how life is. Sometimes there's not a clear villain. You've just got, there's no mastermind at the top of some dark tower stroking his beard and making all this happen. It's just a confluence of misaligned incentives, right? A lot of folks who have been siloed or trained in certain ways. Everyone thinks they're doing the best they can. I'm sure that, in the beginning, everyone feels like they're doing the best they can when they go to the different carriers and try to get the best rates.
Right.
They just simply don't know of the advanced strategies.
Right.
Right? So what should employers be looking for in a consultant if they want to change the way that healthcare is purchased for their company?
I think the first thing is a consultant that is fiduciary aligned with them, that is saying, okay, how can I do what is in your best interest? A consultant that says, this sucks. I'm not going to sugarcoat it. This sucks. And I'm not going to stop at this sucks, but I'm going to walk arm in arm with you to figure out how we, at your level, right, at the micro level, can try to make some strides towards better, while we also work together to advocate at the macro level for broader changes. And so if you have a consultant that is, to your point, right, coming to the table with these advanced strategies, and maybe they don't know everything, but they're willing to ask the questions, they're willing to go deeper, they're willing to continue to learn and to educate in the process, right? That's one of the biggest things that is a part of my job, is if that means that my client is educated enough that they don't need me anymore, or they know how to go and look for the answers, that's okay. I've done my job, because we all have to push against the walls of the system and say, that's it. We are not going to accept status quo anymore. And so we, as the consultant, the employer, and even the employees.
Well, Akua, as we wrap things up for this interview, give us some reasons for hope. I feel like this conversation, anytime we start talking about the healthcare system, it sort of, becomes this negative sort of thing, like, oh dear, how did we get here? But give us some reason for hope for the future. Why should employers be hopeful for the future of benefits?
Yeah, I love this question, because I'm learning more and more about the reasons for hope, because I can get gloom and doom around it. And I think a big part of that for me is the solutions that are coming out, and not just solutions that are still opaque, but solutions that are transparent, solutions that are saying, we agree that there's a problem and we want to partner with you. We want to be a fiduciary. We want to be completely transparent. And, when it comes to a PBM, when it comes to a third-party administrator, like, let's lay it all out. Let's be completely honest with each other about the profit that exists, the profit that I'm making, and I think that's the biggest thing for me is that there are other people who are coming to the table who want to see this thing change, who recognize that we can't necessarily burn it down as much as we would want to and start from scratch, but we can start pulling apart bricks, brick by brick. And whether your space is PBM, whether your space is TPA, whether your space is cost containment or guided navigation, whatever it is, we can all do our part to pull apart the bricks of that building that's no longer serving us, and then work together to put those bricks together to try to build something that's better.
Exactly. Akua, thank you so much for joining me on the director's chair. And thank you so much for being a distribution partner, getting this film out there and making change in the healthcare industry.
Thank you again, Bart. I love this. I'm excited for what else is coming from you and from your team because you're doing such great work.
Well, thank you. And thank you all for joining us on the director's chair. To learn more, simply click the link below and follow up with Akua Smith out of Acrisure, New England. Until next time, I'm Bart Camerata. I'll see you then.